Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. This is our daily update on COVID-19 in our community. With the localized outbreak that you heard of at the Southeast Nursing and Rehabilitation Center, positive cases have gone up significantly. We now have 342 cases of COVID-19 in our community, up from 254 yesterday. We have 93 travel-related cases confirmed and 93 community transmission cases, with the largest number of cases, 120, coming as a result of close contact with another person who is positive for COVID-19. 47 cases remain under investigation. We do remain at 9 deaths from this virus, and 47 people have thankfully recovered. 37 patients tonight are in intensive care and 28 are on ventilators. Regarding the Southeast Nursing and Rehabilitation Center, this is a very difficult situation. As of tonight, 67 of the 84 residents have tested positive for COVID-19. And as you know, one resident has already passed away tragically. 11 tests were negative of those residents, and those residents are separated from the infected residents with separate staffs. And this is a critical point. There are 60 staff members at Southeast, and to date, 8 have tested positive. We are in the process of testing all of the staff, as well as identifying other nursing facilities where these staff members have also worked. This is a tremendous concern for the judge and me, but cities and counties don't have much regulatory authority over nursing homes. That is the responsibility of the state and federal governments. However, the judge and I have amended our emergency orders tonight to prohibit any staff from working in more than one nursing home facility. We also have closed facilities like ball courts and golf courses that were generating violations of social distancing protocols. Finally, we are adding teeth to the enforcement of the Stay Home, Work Safe order. We know businesses, some of which are bad actors, that are warned and later issued a violation and continue to violate the order. They will have their certificates of occupancy revoked, and we will close the business. We will shut you down. Judge?
Thanks, Mayor. And I think it's important for the public to understand that we are doing these joint emergency orders together so that there won't be any confusion about what happens in the city of San Antonio, 26 other municipal authorities, and the unincorporated areas of Bexar County. Let me just comment very quickly on the issue of the nursing homes. We see this spreading around the nation right now, some 15,000 nursing homes, 1 million people in nursing homes. Here in San Antonio, we have 68 in the city, 74 that's in the outlying areas of the county. And if you put that together, we probably have anywhere from 12 to 14,000 citizens that are in either in the nursing home or in a boarding house or an assisted living facility. So we're really stepping up the enforcement of that. The Fire Marshal's office out in the county area is checking on all of them. The sheriff is tracking a lot of the work we're doing, and we're working hand in hand with the city. So we want to get a handle on this. We don't want to see it spread throughout the community. We also want to see them get more protective equipment. We have a limited supply. Nursing homes are third in order after first responders and after hospitals, but we need to get them the basic things such as gloves, such as a mask to be able to wear, and to be able to protect them and their clients that they have at the nursing home. On another topic, the courthouse is going to be closed starting Monday with all exits except 2. You'll be able to come in through the south entrance of the Paul Elizondo Tower and through the east entrance of the big red courthouse, where we have the Family Justice Center. Also, we'll be closing the parks on Easter, over the Easter weekend, which will be following the policy, and trails will continue to be open throughout the county. So we all need to do what we can to get through these next few weeks to make sure that we're not having more and more transfer in our community. We see those numbers going up, and we need to do everything we can to hold them down.
Thank you, Judge. And we are all in this together. We know it's hard to be isolated physically from our friends and family sometimes, but we're all in this together to keep ourselves healthy and to stay alive. We will be back again tomorrow for the latest information. You can get the latest information on COVID-19 by texting COSA.gov to 55000 or by visiting sanantonio.gov/COVID-19. So stay home when you can, practice good hygiene, wash your hands, stay healthy, and save lives. And now we'll take some questions.
Mayor, what was your decision to close golf courses? Where did that decision come from?
Well, I mean, it's difficult because we also want to make sure that people are going outside and getting fresh air. You know, it's part of mental wellness also, not to stay cooped up all day, but we need to practice social distancing. And there's some facilities, ball courts being one of them, that are encouraging congregation. We have to deal with that. So while it's difficult to close some of these facilities, you know, when it does come time to reopen and we can loosen some of these things up, we'll begin to open those, but we have to reduce congregation and gathering as much as possible, and that's one of the reasons why.
Mayor, I understand there's been a change in the criteria for testing, and people will no longer have to have a physician's referral. Can you explain how this change is going to be beneficial to the local response to the pandemic?
Thank you, Scott. Well, this is a significant inflection point in a very positive way for our ability to contain the coronavirus in our community. We do know that we need to emphasize wider assessment, wider testing for our city, and we finally now are able to do that with the protocols that we have established locally. And so today, you no longer need a doctor's order to go get a test. You do need to be pre-screened and set up an appointment. You can do that by calling the COVID hotline, and I'll give you that number now. It's 210-233-5970, but you can get that pre-screening done over the phone, and you can go to, with that pre-screening appointment, you can go now straight to the pre-authorized, pre-approved testing site.
It's really gone up. I think we were running around 100, maybe a top 160, and now we're 300 or more. So people are certainly responding to that and being tested.
Where did the additional tests come from? Because I understand in the news release the city sent out earlier that there were more tests available now. So where did those tests come from, and why were they not available before?
We still get the tests from the federal allocation, but the problem is the protocol for administering the tests has been very strict and narrow. So we have loosened that up, and we're also now going to be working with one of the private labs to get those test results in faster, where that you'll start to see that happen over the next week. But this is going to allow us to get much wider and more rapid assessment of coronavirus in our community.
That's been one of the major frustration points. Doing the test and not getting it back for 3 or 4 or 5 days is not the answer to it, and the federal government's let us down when I think that most of them were going to Quest. Now we have some local labs looking at stepping that up and being able to turn it around in a much faster time.
Do we think making these tests more accessible, Mayor and Judge, do we think making the tests more accessible, will we be seeing more sites popping up around San Antonio?
Well, first of all, let's remember there, and this has been a little frustrating too. We have something like 40 partners out there that are doing tests. You know, they're in clinics, Communicare, a bunch of the others that are doing tests, and we're working with them on getting data. Now they're spread out all over the community, so we just haven't been able to get all the data as much as we want from them. So there's plenty of other places to go other than just the drive-through.
Mayor and Judge, I have a few questions on different topics, so please bear with me. The first, Mayor, this one specifically to you, and you kind of already alluded to this, I guess, with this new executive order, this vape shop that's specifically calling you out, saying that they won't shut down. I guess you had mentioned that now you're going to be revoking their certificate. Is it specifically this business and other businesses that are refusing to close?
With a repeat violation and an apparent disregard for the lives of our neighbors, they're going to get a visit. If they're still operating, we're going to shut them down.
It says, oh, go ahead. Sorry, Judge.
Let me make one more plea. Here we are Friday, and church services will be this Sunday. A plea not to attend services where you have a bunch of people together. One thing that's really been encouraging to us is that we're getting a lot of support from the religious community not to do this. I think, Mayor, you got a rough, these are all churches that have signed up that they're not going to have their Sunday services. Now, we want everybody to have that right to get together, whether it's over social media or whatever the church can provide to you, continuing counseling with you, There's been some talk about maybe some of the churches doing a drive-through or out in the parking lot. And I know that for one church alone, like a Cornerstone, I know they're trying to open it up to other churches because they do have a good communication system with people at home. So that's going to open it up for other churches also to participate.
Also, like this afternoon, and Joey had asked this yesterday about the mask situation, the CDC now recommending that Americans wear the cloth mask. We know the city of Laredo has now made this a requirement. Do you see San Antonio, Bexar County following suit on this?
So we are actually talking with the health department and the hospital system literally moments ago to talk about this, and we're going to be offering guidance. What we want to make sure, though, is that we ensure that there's a supply of PPE and masks available for healthcare providers, for nurses and technicians, even for nursing homes, that we don't make a run on masks that would compromise our ability for first responders and healthcare workers to do their work. But we are working on guidance to help help people understand what the CDC is telling us and how to keep people safe.
I think we're seeing more come on the market now, but we're struggling right now just to get enough to the nursing homes to be able to get it right. So we don't want to have a situation where there's a run on it and we can't get it to our critical workers. So hopefully, if there's a supply, people will have that option. I do see more people today wearing the mask. Some of them have used scarves that they have at home. I suppose that might be just as good depending on the quality of your mask. But I think you're going to see more production of the mask come along. But we just want to make sure when we say you can do that, and maybe you ought to do that, that there's actually a place you can get it.
And let me add one other thing. Don't let masks or even a bandana or something give you a false sense of security. If you're sick, you should not be out. And if you come in contact with someone who is sick, who has a bandana over their face, that's not going to keep you from getting sick either. We don't want people to think that masks replace the importance of social distancing.
I'm glad the mayor said that, because you can have a false sense of security with the mask. Somebody touches you or gets too close to you. The main thing we need to remember is staying 6 feet away from each other. If you can stay 6 feet away, then you're not going to get those large or small droplets. Even if you got a mask on and you're closer, the small droplets can come through the side. So it's not a cure-all for everybody. The 6 foot, though, is stay 6 foot away, don't touch somebody, and I think you're going to be fine. Just follow that first.
Mayor and Judge, someone messaged us. She has a family member that's in the Southeast nursing home. She's wondering who determines when loved ones need to go to the hospital, and how is that determined?
Yeah, that is in coordination with our Metro Health and our EMTs at the fire department. They've worked out a protocol, because one of the other things you have to recognize, we all have to recognize, of people, residents of nursing home facilities, is that they are some of the most vulnerable members of our community with a lot of underlying conditions, some of them even on hospice. And so moving people who are in that condition can be very threatening to their lives. And so we want to do this and make sure they get the care in the most compassionate way that's safe for them and safe for their families and safe for the folks that are around them. And so they've worked out a procedure for that to determine exactly when a transport would be necessary at the very, but as much care as we can provide on site, the better.
One last question. Why are you guys not updating the numbers at 7 o'clock anymore?
We are. Yeah. So the numbers I just gave just now will be updated on the website tonight.
Okay.
There was some confusion on the numbers last. Let me maybe answer your question in a different way. There was some confusion on the numbers last night, because we had posted the numbers because they cut off at a certain point. We posted those numbers. It wasn't until after those numbers had cut off that we got the results of the nursing home residents. So that's why there was a difference.
Mayor, if I can ask about testing for folks that don't have insurance, I understand that they'll still be able to get a test. What about, let's say, somebody that doesn't have insurance tests positive? What kind of care is available for them?
They would still get the same kind of care you would if you had a primary care provider and the best insurance in the world. What we want to ensure is that if someone is positive in our community, that they are isolated and quarantined, whether that is in their home, which usually is the case, and most of the positive infections in our community are getting care at home. But if they require hospitalization, they're going to be hospitalized. We're going to care for everybody. Nobody's going to be left behind.
Got to remember, we don't have a cure for this. If you get the coronavirus and you are tested positive, at some time you're going to show more and more symptoms, and at some time that decision will be made whether you need to go to the hospital. The greatest threat is if you have a shortness of breath. That's the one you better really worry about. You may have a sore throat or you may have a cough. If you have a shortness of breath, that's when you better really get to the hospital. So when you get to the hospital, they can treat you for the symptoms, whether it's pneumonia or whatever it might be, but they can't cure the coronavirus or COVID at this time. So I think it's important for people to know that.
I would like to ask about community support for healthcare workers for when the surge hits. I know, for example, there's an online registry for retired nurses and other people who want to volunteer to work as volunteers at Freeman or other places. And I believe that the judge is looking for some temporary housing for healthcare workers who want to quarantine away from their families. So I'm wondering, do we have all the communication portals in place, for all that communication infrastructure in place for people who want to provide different forms of community support?
Well, first of all, the most important thing for the first responders is to have this. This is what you would call the personal protective equipment. And we're doing a good job of getting that to first responders. We're doing a good job of getting that to the hospitals. And now we need to do a better job of getting it to the nursing homes. And we're working very, very hard on that. Everybody's looking around trying to see what we can do on housing and what we can do to help people that, whether they're first responder or whatever that may be in distress. But if your family member is there with you, there's a way to protect where you're not transferring it over to your family member. I know that's a concern, but there's things you can do to do that, particularly the mask, particularly don't touch the person. And again, it's that 6 foot. I can't emphasize that enough. If I'm home and I do have the positive and my wife's there, she needs to stay 6 feet away from me. And if I have a mask, that's even better. The person that really ought to be wearing the mask is the one that's sick, so he doesn't transfer it out. So I would suggest you have a mask on. But there's ways to do it at home and till we see how that patient may come along.
All right.
Thank you.
Thank you all very much.